Yo, yo, yo. Hey guys, welcome back to another awesome edition of the Best Practices Show. Our goal here is to find the best thinkers, teachers, speakers in all of the world of dentistry to share some wisdom so you can create a better practice and a better life. And we're going to do exactly that today with an amazing teacher. His name is Dr. Marco Brindis. And we talk about the treatment of the edentulous patient and what you need to consider moving forward in the future. It's a great episode. I hope you guys enjoy it. We'll see you soon. Hey guys, welcome back to the Best Practices Show podcast. I get to do the coolest job in the world. I get to talk to great experts, great friends, great thinkers in dentistry, and they get to share great insight with you, the podcast listener, so you guys can create a better practice and a better life. And today we're going to be talking about the treatment of the edentulous patient with a dear friend of mine, Dr. Marco Brindis. Marco, thank you so much for being back, buddy. I appreciate you.
Hey man, it's been a while. It's been too long, and I really appreciate you. I really do, and we always have a good time. So I'm very happy to be here today with you.
Yeah, I appreciate you so much, and so you sent me the text. And just to give you a little background, so Marco and I have been friends for a long time, primarily through the Seattle Study Club and study clubs alike. And so we've always had fun at the Seattle Study Club Symposium. And you've been on the show many times before, done a masterclass. And you always a valuable part. And then you took out a big venture. It's a very big venture. Can you tell our listeners? I always want people to know who they're listening to. So give us a little bio in what you've been up to just in the last 2 years.
Wow, it's been quite a ride. I was in academia for 16 years at LSU. Multiple different positions at the dental school. I was head of the department at some point. Really an amazing experience. But I was missing being with patients, truly. I had to say, truly, I miss LSU for sure. I always will. And I don't regret all the time that I spent in LSU. It was a blessing. I got to spend a lot of time with great. And I would not be where I am right now without having that experience at LSU. So I want to say thank you to LSU. But, you have to move. It's just like being with your parents, that you're very happy living with your parents, but now it's time to experience the world on your own. And that's when 3 years ago I retired from LSU and start looking for a practice, and found this prosthodontic practice in the New Orleans area. And it has been an amazing experience, mostly, and I have to say, it's scary, but a lot of fun. That scary fun of going to school for the first time. That you have these butterflies and all the things that you need to know that I didn't know about to run a practice or everything. But it's very exciting where we are right now, to develop your own team, to develop your own patients, and my goal is always to reach the hearts of the patients, and to have the team to do that. It's been such a rewarding experience. So I'm very happy to be here and being in this part of my life.
Yeah, we're so excited for you, buddy. I knew this was going to be something that you probably had to do at some point in your career, and just like you've championed everything else prior to it, I know you're going to do really well. And I'll just say this, you guys, he is a phenomenal educator, and he comes from a long line of education. And last time we were on the podcast, we talked about how you knew Bill Robbins as a kid. Like, who gets that?
Yes.
Who gets that privilege? Can you just tell that story real quick, just because you're not a newbie
Sure.
to the education world. Like, you've been following dental education at a high level for a long time.
Absolutely. So my grandmother, my father's mother, was a teacher. Then my dad was a dentist and a teacher and founder of two dental schools in Mexico City. So I grew up being surrounded by very passionate, highly educated dentists, surrounded by really good people like Bill Robbins. So my dad used to lecture everywhere. And as you know, Bill Robbins is one of my favorite teachers of all times. Well, my dad was my T1, my favorite teacher of all times. And imagine I got to see my dad and Bill Robbins lecturing together.
Wow.
And I was still a kid, and I was still seeing. Sorry, Bill, they need to know that you're a lot older than me, but uh, it was an amazing experience, and he always took me under his wing. And we are best friends. We are family. That's the way we see each other. He and my dad, they were so close to each other. And you can see actually there's a picture of my dad right here. I'm not sure if you can see, but that's a picture when he's getting an award from the president of Mexico. And he was the health provider of the year at some point. So I was always exposed to this uh, lecturing career in teaching, and is one of my passions for sure, is teaching, and teaching from the purpose of not not by preaching, but mostly by listening, mostly, and kind of like generate discussions and kind of get into the things that we love so much about this profession.
Yeah.
And I grew up being a dentist. I remember being in my dad's lab when I was 6 years old, and that was phenomenal. And when I was 6 years old, I told my dad that I wanted to be a prosthodontist. So I knew exactly not too many kids know what they're gonna do when they grow up, but I said, not a dentist. I want to be a prosthodontist. And thank God I got the means. I had the support from my parents and teachers to take me where I am right now, and I'm very blessed to do what I love the most.
Yeah. You are awesome. I'm so grateful that you're even here. And today we're going to be talking about something that you teach. It's the treatment of the edentulous patient. Now, let's talk about the why first. Walk us through this, because this is going to be somewhat, of a gut check or a little bit controversial because it comes up a lot. But let's talk bigger picture first. Why is this such a hot topic for people that you teach to?
Wow. In my practice, just letting you know, the projection is actually true. There was one article from the Mayo Clinic in 2013, and they had a projection with the baby boomers to have 40 million edentulous people in the United States. 40 million. The projection was perfectly fine, and actually we reached a little bit over 40 million by the year 2020. So there's a big need, and just to put it into perspective, missing your teeth is just like missing any other limb in your body. It's like missing a leg. And I actually use frequently the analogy when patients come to me and say, I have had too many problems on my teeth. Why don't we just take them out and give me some dentures? And they believe that would be a good choice, a good move. And I always tell them, be careful what you ask for. Imagine that you're having problems on your knees, and I'm trying to treat your knees, and you're saying, I had enough. And you tell me, why don't you just cut off my legs and give me some wooden legs? That's exactly what you're asking me for. Wooden legs, because you're never going to be able to walk the same. You're never going to be able to run again. So just think about that. I can make you look very good. I am very meticulous to deliver something that looks real. And I tell them, it doesn't matter if I do crowns, veneers, composite, or dentures. I'm going to make them look natural to you. But that's not the problem. That's easy. The big part is how to make them functional. And how can I get you back in function? And my main goal as a prosthodontist is not actually to save teeth. Is to give you health. Is to provide you with the function that you need. And sometimes that is by saving teeth. Hopefully, I always hope that the solution will be by saving teeth. But not always is the case. And sometimes I have to make the radical decision. They actually sacrifice some considered good teeth with good bone support for the sake of having good health for the patient and good function.
Yeah. Now that's going to be the controversial part. We've always been taught save teeth, save teeth, save teeth, save the teeth. And I love, you and I, before we hit the go button, you said this, I say this to patients, I'm not here to treat your teeth. I'm here to help you get healthier, to treat the function. And you said sometimes teeth get in the way. Now walk us through this, because I know somebody could be listening to this, and this is where you get a little antsy and, it gets a little tense talking about this. So where do I start, Marco, in this process?
I have to get that we have to talk about this in an open way.
Right.
Everybody's feeling afraid to say, I'm going to extract this good tooth. Everybody feel ashamed, or the other way around. I know there is abuse of extracting teeth for cookie cutter protocols. That because you have down one protocol, for example, an implant, a screw-retained implant prosthesis, implant-supported prosthesis, right? That they're very conventional, the typical all-on-4. Mm-hmm. And I think it's fantastic to have protocols like that. But understand that as a dentist, as a good dentist, you cannot be a cookie cutter. You cannot just fit every patient that comes to your practice to that protocol. Every patient has completely different needs with completely different problems, and we have to adapt and follow whatever the patient needs. And yes, it is sometimes that we need to actually get rid of everything, even cut bone to get this type of prosthesis, and in some cases are absolutely indicated. But understanding that to make it as your standard protocol is not a good thing. Let's start saying that, because I don't want to come across through these podcasts. I want to be honest, but I don't want to be point out like, oh, this guy just wants to cut off all the teeth and just to make his protocols. That's not the case at all. And always trying to be as conservative as possible. My dad, going back to this, taught me early in life. When I was 6 years old, he told me, son, when you see your patients, always treat them like your own family. He always told me that. Well, later in life, I actually upgraded that saying. And I tell my patients, my dad told me that, but you know what I think? Now that I have kids, I can tell you one thing. I like to treat my patients the same way I would like my daughter to be treated. Mm-hmm. And with that in mind, that's how careful I am to choose to treat the patient. So going back to think about being at war and you suddenly got injured, and suddenly your leg, going back to the legs, got really injured. And the doctor has to make a decision right there on the spot. Should I save the leg or should I save the patient's life? And sometimes they needed to amputate that leg to to intercept that infection and not pass it to the rest of the body, right? So it's pretty much with the same analogy. At the end, what's more important than a tooth is the patient.
Yeah, so true. Yeah, so true. And then, if I'm a dentist listening, give me some scenarios on, I'm thinking first, extraction, implant, denture. And I know we're not going to make this a standard, but give me some scenarios that you're thinking. And then if you want, let's go through FB1, FB2, FB3. I mean, you take us on this journey. Where do we start?
Okay. To tell you the truth, it's not been so long that I know these terms, FB1, FB2, FB3. Right. But I think I am glad that I learned them, because it's easier to talk to the patients, it's easier to talk to the professionals to know when to do what. FB1 is when you are going to place implants, when you're going to have a full arch of implants, and the only thing that you're going to be restoring or need to be restored are the teeth. So you have perfect bone, you have perfect gum line, right? Perfect gingival margins, and now you're just gonna restore the teeth. So you just extract teeth and replace them with implants, and then you do crown and bridge, and just having an FB1. That's whole FB1. I'm gonna now go to FB3. Patients that bone, they has a lot of resorption. Now, the resorption not only vertically but horizontally with lack of lip support. Now we have to restore more than teeth. Now it's about to restore teeth, gingiva, and bone. So you have to restore all that. And that's a clear example of that would be an all-on-4. When you have a prosthesis that has the teeth, it has the pink ceramic, and then you have the implants, right? So that would be an FP3. And the case is, like I say, going back to the cookie cutter, is not to have your mindset that everything you have to convert into an FP3. All right? And there are many things, many considerations to decide one way or another. One of the things that I start by making my decision is based on the patient's health. You know, what's going to be, and there's many systemic diseases, or in my own practice, I need to decide, I need to make these decisions every day. In this type of practice, in prosthodontics, I get to see the end result. I don't get to see the patients that every dentist can see. I get to see the patients that are a complete mess. So I constantly say, you know, when you have a dentist, it's like having a contractor in your house. Your house still there, comes there, fix the room, fix the door, fix the windows, fix the roof. You know, when the patients come to me, they're looking for an architect. How can we build back the house and get it in functions? Because it's already too much damage. And sometimes I have to demolish that house and build from the bottom up. And sometimes I have a chance to has good bones. The house had good bones. Now I can go ahead and renovate it and have a good quality for a long term and save that house. But sometimes I don't have that luxury and I have to start from scratch.
Yeah. Fly into the eye of the hurricane. So as I can imagine, you're a prosthodontist, a very, very excellent one. You're not doing these cases by yourself. There are other dental professionals you have to communicate with, orthodontists,
Absolutely.
periodontists, GPs. How do you manage that dynamic? Just give us an insight on how you do that.
Absolutely. And you will notice that it's a huge difference to talk to a periodontist and an endodontist than an oral surgeon. It's a completely different mindset. And it's completely understandable. And I'm not saying there's no wrong and right. It's understandable that, for example, a periodontist, what's their main goal of a periodontist? Let's try to save your teeth. Let's try to maintain the bone around your teeth, healthy around your teeth, so you stop having any bone resorption, right? So they do their best and they're doing an excellent job. I applaud them to still trying to save teeth. That's wonderful, right? Endodontist, they're trying to keep the tooth. They're trying to keep a tooth with PDL, right? Instead of extracting a tooth together with the PDL and having an implant. I am always on the side of the tooth. Understand that part. I'm always on the side of the tooth when it's possible. And then you talk to an oral surgeon, they're going to have a more aggressive, they have a bigger view of the problem, all right? So this is going to be easier to comprehend for them when I tell them, you know, can you please extract all these teeth? They don't even question. You're like, yes, I understand. I do that all the time. I do a lot of demolitions. They are trained to extract teeth, not to scale, not to save them, not to put medicine on the teeth, but they're trained to extract teeth. So it's a completely different mindset. So just yesterday, I was having a conversation with a periodontist friend of mine, and she referred a patient to me for treatment. After evaluation and analyzing all the different pros and cons, I came out to the conclusion and recommended to the patient to extract the remaining teeth and have dentures. And the patient was okay. But my periodontist called me, hey, wait a second. I've been maintaining these teeth for so long. What's going on? Why do you saying that now you're going to extract the teeth when I can save these teeth? He's like, I completely agree with you. And I told her about what I talked to the patients. He's like, but I have to keep in mind that my ultimate goal is to treat the patient's health. And sometimes that means to extract good-looking teeth. Okay. In this particular case, let me just guide you my thought process with this particular case. The patient, it's in mid 60s, late 60s, let's say 67, woman. That has history of generalized periodontitis for a long time. But here's the thing, it's not generalized periodontitis only, okay? It also has a history of multiple restorations, large restorations. So every single tooth in her mouth has some sort of restoration, crowns. So that's another category of patient. It's not the patient that for some reason just the bone will start to go away, but it's a combination of both. So now, in order for me to, you have a restorative need other than the bone. I understand that you can keep that good. Now, in order for me to restore the patient, I have to now do a full mouth reconstruction. Now I have to prep every tooth and I have to do crowns and everything. On teeth, they are questionable, that don't have an ideal prognosis. So think about that. That's when the financial point comes to a play. It comes to, there's a, hey, we live in a material world and I'm a material boy, right? So no, just kidding. So, but truly, it is true. We have to be honest on where we live. And it's a reality that there's a financial decision as well.
Yeah.
Okay. And we have to go for that. So I tell my patient, look, if by any chance you have $1 million under your mattress, my treatment plan would be, let's go ahead and try to save all this teeth, get a full mouth reconstruction. And if it doesn't work, I mean, we try, then we extract the teeth and we can probably have some implants and then restore. That would be the right answer. The right answer is that. And I actually would try to save every single tooth every time if I was having all the money in the world for my patients. Mm-hmm. But the reality is that they cannot, they have to put their whole money in one basket, in one problem only. They cannot tackle the problem multiple times. They have one shot. And when they give you one shot, you have to make a decision based on how long is that treatment. I can not guarantee, but I can predict is going to last. And if that treatment, I know it has a high chances of not lasting, that's when I have to rethink and see what would be the thing that it would last longer for my patient.
Yeah. Okay? I love it. Keep going.
So in this particular patient, she comes here, has some mobility, has class 2 mobility. Okay, edentulous spaces. So think about it. As a prosthodontist, okay, you have teeth and you have edentulous spaces. Let's do a partial. You know how there's different academies. I'm not going to mention the name because I don't want to put him on the spot. However, very, very, very high-end academies that I'm a member of, they actually give a name to partial dentures, and it is the long-term extraction device. You see these pieces with wires and everything, and as much as we learn and as much as we taught students how to have a passive fit, you tell me, does it really have a passive fit? No. You know why? Because it depends on the hands of every patient. Because sometimes they put it this way, sometimes they put it the other way, and they apply extra stress on other teeth. Because sometimes they put it in the mouth, they dump it in the mouth, and then they position biting down. So there are many times that constantly you are using forceps on those teeth. So the periodontal has completely intact to go that route. So now you have periodontal problems, and I'm going to do a partial, and I'm going to do survey crowns. That start adding up, crowns, survey crowns, and then having a partial, and on teeth that are not periodontally solid. It just makes you think, how long this is going to last?
Right.
And again, if the patient tell me, it's okay, I'll do it, and when I need another thing, then we go another route, fine, but it's unthinkable that that's going to happen. So in this particular case, for example, They were, if I remember well, the premolars have root canal with still existing PA lesion, extensive PA lesion, infection, all right? So let's calculate the odds, right? So for me to save them, I have to retreat the tooth. By retreating the tooth, we are decreasing the prognosis of that tooth, right? And then I have to add a crown that is going to be in a tooth that is not very strong, a tooth that is more fragile. And then I'm going to add clasp around that. That's one thing. Then I continue with the front. In the front teeth, have a class 2 mobility on the centrals, right? Some decay. Not necessarily crowns. And then I move to the other side, the same scenario. Premolars, first premolar only with a PA lesion and a distal extension. The patient chief complaint. Very important to listen what the patient wants. Of course, that's the main thing. Listen what the patient wants, but we cannot stop there. Because if we only do what the patient wants, what are we here for? What are we starting for if the patient is going to tell us what to do? No. It's to listen, and then you have to propose the best course of action for the patient with the dentist knowledge. I always tell them, when you come to me and tell me what kind of material you want me to use and stuff, it's just like, come on, do you go to the cardiologist and you tell them what kind of stent do you want, what brand of stent you want in your heart? No, come on. You have to trust me, otherwise this is not going to work. I am the one that knows. I know I'm the one that has all the training to do this, and you're coming here to get you my best, right? So I listen to the patient, but at the same time, I have to propose what is best. All right. So but again, I talk to the patient and I tell him, what's the scenario here? One last thing that I didn't mention. The patient doesn't like the appearance of the teeth. The patient doesn't like to have the black triangles in between the teeth because of the recession that she has. All right. So come on. So if she tells me, I would like to address my smile, I have to tell her, I can't. I cannot do it with the teeth that you have right there. I just can't. Why? Because can I do some sort of porcelain with pink? I know anybody can tell you, oh, there's pink porcelain. How hard is to really do pink porcelain that looks good and that can be hygienic at the same time? It's very difficult. And I know you have had Christian Coachman many times, and he used to teach before the DSD. He used to teach a lot on pink ceramic and the interface and everything. And he used to say, the more aesthetic you make it, the least cleansable it's gonna be. Okay, so there's a lot of considerations to make, and in fixed prosthodontics around periodontal condition in pink ceramic, it's not gonna work. Not to mention in these patients, because of the bone resorption, you don't have enough lip support, and it's affecting them facially. Now, when we have to be careful, because when we talk about aesthetics, we have the tendency to judge people like, they're so superficial, they just care about aesthetics. I mean, just? It's not just. It's your mental health. It's how do you present yourself to others. And it's perfectly fine. We are all vain. Okay? And at the end, it's just like Mr. Miyagi says. It's all about balance.
Yeah.
It's all about balance. And yes, it's important as long as you don't go crazy on that and you forget about the health because you want the appearance to be better. No, it's a balance. And at the end, what God gave us is balance. He just gave us a balanced face, a balanced body that happens to be very aesthetic.
Mm-hmm.
That the more we have that symmetry, we are healthy, and the healthier we are prettier. And that's a reality. So we want to have that balance when we provide the patient with the function that they need in natural look, making the patient look absolutely perfect, wonderful, and have a good smile and have a quality of life. There's a reason why God gave us a capacity and muscles to smile, right? And we don't want to shut that down. And we all know that the more you smile, the healthier you get. And there's no doubt, there's a fact. This is not my opinion. We all know that smile actually creates a much better, healthy state of the body.
Yeah.
So that's huge. So for me, it's telling me that. So when we were discussing this with my periodontist, she said, "But look at these canines. They're big. They're pretty much intact. Just this cavity over there, but pretty much they're there. They're perfect. Why don't we just work around those?" And I said, "Okay, let me take a look on the patient again, and what I can do then as stage." Because at the end, we were just having this discussion to save the canines. Okay, so, and don't get me wrong, I won't judge anybody that tells me I want to save the canines and work around them with a prosthesis. Fine, I'm perfectly fine with it. I think we just have to work in a way that we have a plan A that can connect directly to the plan B. So in other words, what I'm saying is, when I treatment plan these cases, I try to come up with a plan A that actually is the beginning of a plan B. That is not a completely separate treatment that you have to pay 2 treatments, but actually plan A is part 1 of the plan B. You know what I mean?
Yep.
So in other words, put everything set up so in the future the patient wants to add up implants, we can always add that to the prosthesis without starting from scratch.
Yeah. So well said, my friend. And I know this only opens the door to more conversations. I'm going to have you back again and again. We're going to cover a lot of different topics. And I know I can't keep you all day. I love talking to you. I love hanging out with you. But I want you to give us some final last thoughts if I'm listening to this. And, and then I do want you to talk about what you do, your lectures and things like that. But before we do that, give us some final thoughts on.
Well, at the end, like I said before, I think the final thought is to have these type of conversations to yourself, to your staff, to your patient, with your colleagues, with your different specialists. Have these conversations in an honest way, always keeping in mind what I said. Treat the patient like your own family. Treat the patient like the way you want your most precious love in your life to be treated. And when you keep that in mind, make the decisions that you have to make, and you're gonna be fine. And don't hesitate to make radical decisions when those radical decisions is gonna change the patient's life, when those decisions can reach the patient's heart.
Love it.
And pretty much, I want to just capture it like this more than a specific clinical recommendation, but at the end, just go back to the core, in our core, and why are we doing this? And we keep that in mind, you will take good care of the patient financially as well as health. And you're gonna find that Mr. Miyagi balance of the different components of making a decision.
Yeah. So well said again, my friend. Now, if somebody's listening to this and they want to learn more about you, I want people to follow you. I want people to figure out how to see what you're up to. And then if you're a study club director and you haven't had Marco out, what are you thinking? You got to have him out. He's a phenomenal educator. Marco, how do I find out more about you? Where do I go?
The email address that I use specifically for lectures, it's marco@smilesbymarco.com. Okay.
Awesome.
And that's the best way to reach out me also. I'm not sure how you manage that, but that would be the best way. And once you have that, probably I can contact you and we can discuss a little bit more on what's the topics that you want to cover and everything. But definitely we have different topics to talk about. We were discussing this before our podcast, that I have lectures on treatment of the edentulous patient, implant-supported prosthesis, and to go over all the different options that we have. That's a different story, right? That once you made the decision to extract the teeth, what's the type of prosthesis that is best for each particular situation? So we have that in one of my lectures. And the other one that I'm so passionate about is the material selection and even the type of preps that you have to use for the new type of materials, stronger materials that we have available. and how to make the type of bonding that we have to use for each material, as well as the type of preparation, because it changes. But the most important thing that I like to teach or to bring to the study clubs is actually to make them think of why. It's not just to impose, you have to prep like this, but understanding the whys is going to give you a lot of versatility on how to accommodate and not be a cookie cutter dentist, but actually apply your knowledge and your principles and make it a unique experience for each patient. So that's the kind of the topics that I lecture. I have full days to do that, and definitely I love teaching, and I love to learn from different study clubs, and that keeps me motivated and passionate and very on the edge and very thirsty.
Yeah, well, you're extremely excellent at it, so I'm so pumped to have you here, my friend. So do me a favor, if you're listening to the podcast and you're not taking notes, don't worry, we're taking notes for you. You can flip up to the notes in Google, Stitcher, iTunes, Spotify, wherever you're consuming podcasts, and you're going to see all the things that Marco and I discussed. We've got them all listed right there. So make sure you follow along and check out some of the great things that he's up to. So, Marco, thank you so much for being on today, brother. I really appreciate you, my friend.
I appreciate it, man. I appreciate it. Thank you so much.
Yeah, stick around while we say goodbye to everybody else. But thank you guys for listening to the Best Practices Show podcast. Hey, if you enjoyed today, which I hope you did, do us a favor, hit the share button. Keep sharing this with all of your friends. I don't know how it's working, but I'm super grateful. And we're going to keep bringing it with some of the best minds, best teachers in all of dentistry, so you can help create a better practice and a better life. So until we see you guys next time, or you hear from us next time, keep watching or keep listening to the Best Practices Show. You guys enjoy your day.